I chaired the first oral abstract session for the Nursing Symposium. It was really great because we had like a real mixture of abstracts, mixture of topics, which was really great for the nursing community. So we started off with one of the newer therapies, talquetamab, about the oral sort of toxicities and skin toxicities. So really important topic for nurses, and just looking what the incidence is, but also more importantly how you can manage it and patients' quality of life, what sort of treatments were being used to help minimise the side effects and people to deal with them, and how to kind of explain them to patients as well, which is the nurse's role. So that was really good. Then sort of topic changed. The next one was looking at quality of life tools. So actually, Hayley from Australia presented on the quality of life tools, looking at getting patients' opinion of the tools, lots of different quality of life tools, and a lot of them are used in research, not so many in the clinical area. But it was really interesting to see what patients thought of these, and actually that they didn't seem to mind filling tools out, for one thing. They kind of quite like to be asked. And it showed which one sort of, basically that not one tool was suitable for everything. So it was a little bit like you use the tool for that situation or for that group of patients. So it's maybe different if someone's on a trial or different in the clinical area. But it was very useful to look at how we sort of build that into more everyday practice of using quality of life measures. And then the final one, the final abstract, which was from the UK, from the UCH in the UK, was about MRD, so minimal residual disease in myeloma, and actually looking at some of the psychological aspects of that, which was an absolute great topic, I think, whether for the nursing audience or a medical audience, but it was very much about how if somebody was MRD positive, which meant, that potentially, it wasn't such a sort of favourable situation to be in, that patients would view that very pessimistically. Their attitude towards their disease and sort of how they felt about it changed a lot. And if they were MRD negative, then they felt a lot happier. The clinicians were found it a lot easier to share that news with them. So I think learning a lot really about how we talk to patients about MRD results, when we talk to them about it, just preparing them for that, really knowing that the psychological impact can be pretty huge. There were three different topics, and all really interesting and great presenters.